My name is Jose Pietro Aparicio.
Where do you work and what is your role?
I work at Lutheran Family Health Centers in Brooklyn. I work in the Department of Performance Improvement, in risk management, corporate compliance, and patient safety.
What role has the Latino caucus played in your work or professional development?
Oh, the Latino caucus has played a very important role in my career. I came to the Latino caucus about 7 years ago, and I was at the APA because I always have been interested in public health. I walked by the Latino caucus booth and I met a bunch of people who were very welcoming, very friendly, and introduced me into APA Shade and introduced me into what the Latino caucus is doing with the Latino community in the United States. So the Latino caucus has been a tremendous help and support for me.
Okay, great. Now, how did you get to where you are today? Please tell us a little bit about your background and what inspired your career as a Latino in public health.
I was inspired to be in public health back in Honduras. I am from Honduras. I was born and raised in Honduras. I always wanted to be a doctor. So I went into medical school. I became a doctor, but I always heard my mother talking about public health because my mother is a public health nurse, and she was always very excited about public health. When I went to medical school, I had a few classes, but didn't quite understand what public health was. But in Honduras, to get your final certificate as a physician, they forced you to work in the countryside. So they made me go to a small village in the countryside of Honduras near the border with Guatemala. And that's when I really understood what public health was. And I saw the need in the communities, not just for my medical services as a doctor, but the need for clean water, the need for education, the need for access to services. So that's when I really understood what public health was, and from that experience, I decided that I didn't want to go back to one of the specialty in medicine and work at a hospital. I decided I wanted to be in public health, and I had this amazing opportunity to go and study public health in Jerusalem, in Israel.
Okay. Now, were there stumbling blocks along the way?
There were many stumbling blocks along the way. I got I got polio when I was a year old. So growing in Honduras and a family with not much resources was very difficult for somebody with a handicap problem. My family did not have many resources. The last child of 7 brothers, and we were raised by a single mother. So there were always a lot of needs, and there were always a lot of obstacles. But fortunately, there were always people around, and I also was able to get scholarships all through my education. So it wasn't easy, but I had a dream of becoming a doctor, and then later that expanded to becoming a public health professional.
Okay, now what advice would you give a Latino or Latino student interested in a career in public health? What do you wish someone had told you about early on in your career?
What I wished in my career is to have mentors that could guide me to what I needed to do to reach my goals, because very often I knew what I wanted to be or to do, but I just didn't know how to do it, and I made many mistakes because I just didn't know. So I wished during my career as a young student or young professional that I had a mentor that could have guided me. I think it would probably have been easier. I didn't have that. I had to do it all on my own. So what I would tell students and young professionals is find a mentor, find somebody you trust, somebody you believe that can help you out, and somebody that is there to provide support in the times where things to be very difficult, and somebody who will be able to guide you on the right direction.
Now, are you in research?
I'm not in research now. In the past, I participated in some research, mostly in the area of public health.
Based on your past experience, what are some of the soft skills that researchers need to advance in their careers?
When I was in research, I think one of the things that really are helpful is one, to be curious. Second, to see what areas need to change, and what areas your skills or your knowledge can have a big impact. So I would say just keep that curiosity going, never conform to what you know, to the box. There are always opportunities, there are always alternatives out of the box. So there are always other ways that you can solve a problem. And so don't think in research just what you know or understand. There are always alternatives. So I think curiosity and desire to break out of the boundaries, out of the box, that's always very helpful when you are in the research area or working in the research area.